Wrinkles, facts and causes. One of the most reliable signs of aged skin is an increase in the number and depth of wrinkles. Other signs include irregular pigmentation, skin thinning, and laxity. Many of the changes found in older skin, but not all, are due to the exposure to ultraviolet light. Wrinkles can be divided into two functional categories: fine surface lines caused by ultraviolet light and deep furrows caused by muscle contraction. Wrinkle treatments are in general much more effective for fine lines. Deeper creases may require more aggressive techniques. Environmental factors that promote wrinkling include smoking, degree of pigmentation, heredity. Some families wrinkle more. And most important, occupational and recreational sun exposure over the course of many years. Treatments available for wrinkles include topical medical treatments such as vitamin A acid, alpha hydroxy acids, antioxidants, and moisturizer. And more invasive procedures such as glycolic acids peels, deep peels, dermabrasion, laser resurfacing, surgical procedures, and Botox. Introduction to wrinkles. Although wrinkles can signify wisdom, or at least some level of maturity, there is no question that newly born infants also have wrinkles. The real concern that most of us have is that certain types of wrinkling is associated with aging. Aging in our current pop culture is not viewed positively. Generally, the treatment of normal skin aging that does not result in a functional abnormality is termed cosmetic. And most cosmetic procedures are not covered by health insurance. Many products and procedures promise to reduce wrinkles. Some do little or nothing. Like the products that claim they reduce the appearance of fine lines, which means that they don't reduce the lines themselves. Others can achieve a fair amount of success. Although all of our skin ages, sun exposure dramatically enhances the rate at which this occurs. Changes brought on by sun damage. Photoaging include dryness, really roughness, sagginess, skin growths like keratosis, lentigos, liver spots, and wrinkles. Just compare the facial skin of a poorly pigmented farmer to the skin of his buttocks. Most wrinkles associated with aging appear on the parts of the body where sun exposure is greatest. These sites are the face, neck, the backs of the hands, and the tops of the forearms. Wrinkles come in two categories: fine surface lines and deep furrows that are related to muscular contraction. Some deep furrows are anatomical in nature and have little to do with aging. Generally, it is only the aging wrinkles that really bother people. There are two basic approaches to the amelioration of these signs of aging: prevention and treatment. Topical wrinkle treatments are, in general, much more effective for fine lines. Deeper creases may require more invasive techniques, such injection of fillers, local muscle paralysis, or plastic surgery. There is a special form of wrinkling called cellulite that produces a cottage cheese-like appearance to the skin. This is most commonly noted in the hips and buttocks of women and is due to fat deposition in certain anatomical areas in the dermis. Causes of wrinkles. There has been a long-standing belief that chronic stress causes people to appear older, but most of the evidence to support this fact has been anecdotal, based upon people's perceptions and observations rather than scientifically validated. However, a small but significant study in 2004 showed the first link between chronic stress and aging. This study shows that telomeres, structures at the ends of chromosomes that shorten with aging, also shorten prematurely in people experiencing long-term psychological stress, in effect, prematurely aging the cells. What factors promote wrinkles? Factors that promote wrinkling include the following: smoking. Degree of natural skin pigmentation, more is better. Sun and ultraviolet exposure. Heredity, some families wrinkle more. The loss of subcutaneous fat on a person's body, people with more subcutaneous fat have fewer wrinkles. Some of these factors are beyond our control. The main preventive measures we can take are to minimize sun exposure and not smoke. These measures can, at best, delay wrinkles. SPF numbers on sunscreen labels refer to protection against UVB radiation, the sunburn rays. Higher SPF numbers are better at protecting the skin than lower numbers. Broad-spectrum sunscreens offer protection against UVB and UVA radiation, longer-wave ultraviolet light. UVA rays are abundant in sunlight and are produced by tanning salon light bulbs. They may not cause immediate sunburn but do produce aging and an increased skin cancer risk over time. Sorry, but there is no such thing as a safe tan. Sunscreens that block UVA indicate this on the label and contain ingredients such as parsol, mixeryl, and benzophones. Thanks for watching, and please subscribe our channel for watching more videos.